have a very deep bite and my teeth are small, and I'm self-conscious about my smile, so I don't really like to smile with my teeth showing. And I also have the functional aspect in that I know I've ground down so much of my tooth surface and my teeth are sensitive. Now I'm basically chewing on my front teeth. The wearing down of my teeth has definitely had an impact on my face. It's very aging. I've lost height on my face. Restoration with volume, with injectables, it doesn't help because I understand that there's more of a structural loss which can't really be compensated for with injectables. I'm about 24 hours now having my teeth reconstructed, and I'm so happy. When I had the first session done on Monday, the upper teeth, I was having tears on the way home because I felt so grateful that I have the opportunity to have exactly what I need for my situation. I tried to do braces. It was a terrible experience. My enamel was so thin on my teeth, they didn't even have anything to bond the braces to. And I can't even imagine the sensitivity that I would have experienced if I had had veneers done. And I knew from the moment that I met Dr. Muslin that this was exactly what I needed. So I feel incredibly fortunate to have found this dentist who has amazing skill and has made me feel comfortable and has done an amazing job from start to finish. So I'm about 3 weeks out from my procedure and I'm so happy. I feel like this has been life-changing. It's maintaining my oral health, which is my most important consideration, and then I have the added benefit of the wonderful cosmetic results so that I feel comfortable smiling, and now I have a great smile. My crow's feet are improved, I have structural support for my mid-face, my jaw position is better, and I'm also not having this constant wearing of my TMJ area, which ultimately was going to be a problem. I was really surprised when I saw the x-rays on my initial assessment to see what that TMJ area looked like, and it was bone on bone. I don't have any discomfort, and my jaw alignment felt great, even from day one when I had the jaw track placed in preparation for the restoration. As a plastic surgeon, the thing that I've also found very interesting is I had so much collapse of my face, especially my mid-face, that it almost looks like I've had a mid-facelift. I was having filler in my lips, and I was trying to do everything from a rejuvenation standpoint, but I still didn't look youthful. I even had an upper lip lift to try and have more tooth show. But of course, none of that was going to help because my teeth were short, they were ground down, and I had lost height of my teeth. But now that I have structure in my face, it's really opened up my eyes as well, which is incredibly rejuvenating without having to do anything, without having to do filler or having to do any surgical procedure. It's really important to be able to have a procedure that actually non-invasively repositions the jaw. That's exactly what is needed, and then to build from there. So all in all, this is addressing everything that's incredibly important. The function of my teeth and jaw and chewing and the structure of my teeth, and then the wonderful added benefit of having the cosmetic results that I would never be able to replicate even as a plastic surgeon.